Hi everyone. Today we have Gregory Dajer, who is the director at MTTS Asia, and MTTS is a Vietnamese medical equipment manufacturer that designs, manufactures, sells, and delivers equipment for intensive newborn care, designed specifically for remote hospitals, especially in low-income communities. So, since its inception from 2004 to 2014, MTTS has grown far and wide and has become and is now today a profitable social enterprise serving over 60 markets around the world. And in 2023, now MPTS is ready for its next phase of growth. So we have here with us Gregory Dajer, who's going to speak to us on MTTS's genesis, where he has come so far with the company, and where does he intend to take MTTS to go. And alongside all of that, we will try to understand how the AYLP, or the Asia Young Leaders Program, fits into this whole big picture. I guess we shall begin with your journey, Greg, in Vietnam and MTTS. I understand that you are Polish, and somehow or other we find you in Vietnam, and we would like to start off with that. Just if you could tell us more about yourself, your background, and share with us your journey and how you came to found MTTS.
Yeah, I come originally from Poland, and that's where I grew, and I got my education, at least to the high school level, and then I continued study in different places around Europe, and it's very, very popular to do that in Europe through different educational programs. So usually spend a semester or a year in another university in different country. So it happened that I spent a semester in Denmark, and that's where I met my future wife, that is co-founder of MTTS. Obviously, at that time, we didn't know what's going to be in the future. We didn't plan anything like that. We were just hanging out, getting study together. And after we finished school, now co-founder of MTTS, my wife, returned back to Vietnam, and I returned back to Poland, and I started working for a manufacturing company that it's a Swedish company making trucks and buses, quite well known. It's called Scania, and that's where I got my first real work experience, and it was all related to manufacturing vehicles, but high level of details. And my background is finance and business. So I obviously wasn't manufacturing those devices myself, those vehicles myself, but I learned a lot through financial management on every aspect of the company. I was a young employee, and I had to learn pretty much everything from the scratch about what is happening technically in the company, and how it's translated to the figures, and how we put our financial statements and planning, forecasting, and everything related to financial management. In the meanwhile, my wife was back in Vietnam, also full of ideas. She's Vietnamese, born in Hanoi, and she came up with some ideas together with friends, American volunteers that were working in the National Hospital of Pediatrics in Hanoi. And they really tried to help address the existing situation, which is, frankly speaking, miserable at the time in Vietnam in regards to healthcare. And their focus was on neonatal intensive care. So we were in touch together with my wife. Not even a girlfriend at the time, my friend. And we were just figuring out what is our future. And we knew somebody has to make a move. And we were considering what is better. And she was talking about her work, and I was talking about my work. And to be honest, it was so much more exciting to hear what she's saying. And it was obviously me moving for her, but also all the expectations and ventures that I was seeing in Vietnam were really appealing to me. So it wasn't only like my desire to help, but was very egocentric need to change my life, and selfish, I would say, because it was just, I really wanted to change my life as well. And I arrived in Vietnam, I think, in the perfect moment, and at the time when her project was kicking off really strongly. The volunteers working on the devices that were helping the neonates, and And they really had not much experience about how to make it to the production and how to make it to the company and how to make it profitable. So there was a lot of issues that they ignored, not because they were ignorant, but because they didn't have any experience. So that's after a kind of a lot of conversations, 3 visits in Vietnam for me as a tourist, and watching what's happening here, I decided to move to Hanoi in 2006 in September 26th, and we're gonna forget the date, and that's when I was helping, volunteering at the beginning. I mean, volunteering, working for free, because that's what's happening in startups. Organized everything together with Nga, and considered as co-founders from that point on. And so that was my very short story how I ended up in Vietnam, but it was quite a few detours on the way, so I really don't want to bother anybody with that. But it was a few zigzag ways before Hanoi was my home.
Yeah, I bet it was a very challenging journey, but a challenging journey that in the end ended up with the founding of a company that you know does a lot of good for the Vietnamese public, and as well as we will understand much later to into other markets as well. But before we jump ahead, I would just like to know, you've been in the neonatal care industry for the longest time. So if you could give us some insights into the landscape of neonatal care in Vietnam and how it has progressed since the 2000s. And if there's a lot of talk about discrepancies between the developing and the developed world, and particularly Vietnam is still a developing country. Back then, it may have been underdeveloped as well. How would you compare the situation with more developed markets in, let's say, North America and Europe?
At the time I arrived in Vietnam, the situation in hospitals was obviously very different to what it is now, and especially in regards to the infrastructure and availability of medical devices. So what was really striking was that there was a good number of well-trained doctors, and especially in the biggest cities, and also down to the provincial level. So 64 provinces, quite a lot of them. I was really impressive, I must say, because they knew what they're doing. They improvised a lot because they didn't have access to the medical equipment. Most of the equipment they had was secondhand donated Western device that one of the biggest problems is that they are not only difficult to use, but also quite expensive to run. They often rely on expensive consumables, and that's what remains a business model in this industry. So getting the device that basically at costs is common, and really making money on the consumables that you provide during the lifetime of the device. It's very common when you think in consumer goods. It's very common when you buy printers, you pay a lot for the ink, and when you buy a razor, when you pay a lot for razor blades. So this is really something popular, and medical industry is very often based around that model. So what it means for Vietnam, what it meant for Vietnam at the time at least, was that the devices that were donated were just not used. So you could see them everywhere, but not in the wards, different junkyards around the hospital. Even though the good intentions, but they didn't work by the people who donated them, they just simply didn't work. So we were trying to address the problem by developing the devices that are as good as the Western ones, but they will be either no consumables at all or very limited, because it's not always possible to eliminate them. That is said true. We were trying to address the gap. The doctors were improvising a lot of their own solutions, so we were helping them. That's why we had so much attention from those really well-educated doctors, and that was something that gave us a big impulse, and I think without that, it wouldn't work. So the first aspect was to make sure that they have tools. Doctors have tools, and that's where we came in. And the second thing that were happening slowly, the government was recognizing the needs and the fact that financing the public healthcare has to be improved, and they invested a lot of infrastructure. So slowly, now when I compare Vietnam 17 years ago and today, I can see the infrastructure, not only hospital, but talk about hospitals at the moment, improved a lot, really a lot. We have well, newly built hospitals, good facilities, not perfect, I must say, obviously, but good enough. So doctors have the second important aspect covered, which is infrastructure. And now they have the tools that they can use. The skills were there, now they have to keep upgrading them, educating themselves. The medicine field is very dynamic, it's changing all the time. And you could see that the patients are gain trust for coming back to public healthcare. So the patients are coming, and not only like previously, which was really striking, the couple biggest national centers that were good doctors and they have financing infrastructure, but around the country. So that's really something that's difficult to achieve, but keep those patients that don't have to go to the highest level hospitals at the provincial level. So this is really slowly being achieved here in Vietnam. So that is a really big change, and I think Vietnam is not yet, on the Singapore level, Malaysia level for sure, but I think it's approaching, and I think we can see a lot of good signs, and all the other imperfections are related to other things than infrastructure or medical devices. So that is really massive change. And now comparing Vietnam to the Western countries in terms of medical devices or healthcare providers, it's well, as I said, especially the American system is so biased by big lobbies that promote the solutions that are expensive, justifying them that you have to pay for quality, but really many of the solutions are about providing unnecessarily expensive consumables. So cost per patients are really high, and that was prohibitive in Vietnam. We were basically not treating them with these solutions. It's impossible treatment. So we really have to continue our focus on eliminating or reducing consumable costs, and that's the key to success. And it's not only Vietnam anymore. It's a wider market we serve in, and it's true everywhere where we work. And those solutions wouldn't be used if we provided them with expensive consumables. So that's a huge difference between those markets, Western markets, developed markets, and markets in Vietnam, because there is a reason for that, and I don't think it's going to change anytime soon in the West, at least, even though there's certain new area or new impulse to kind of change those things related to environmental protection, because that waste, that consumables create waste, obviously is justified by higher, more important patient health than anything else. But the disposable consumables are biohazard very often. So it's not only plastic, but biohazard plastic that has to be contaminated in a certain way. So there are different solutions available, but I don't think it may change anytime soon in the West, as long as there's money there and people are a bit comfortable, very comfortable with what it is. There will be no changes. So this is, if you just summarize that answer, it's really the difference between those two markets that are consumables, expensive consumables.
Yes, Greg. And also, I think MTTS found a sort of like niche, and you found that niche for MTTS. But in the early days, of course, as any business would, any startup would, you would face some difficulties in find your right footing in the market, financing, so on and so forth. And that is where our paths crossed between MTTS and GIFT for the first time in 2014 for the Global Leadership Program, where MTTS was then the project partner. And as part of the output for the GLP participants were tasked with developing a solution for MTTS, which was a business model, to help MTTS find opportunities to grow its business and to shift to a more commercially viable and profitable social business in the short term. So that collaboration with Gift in the beginning, could talk to us about how that experience was and how has the GLP sort of shaped MTTS's growth strategy?
Yeah, I remember that very clearly, even though it was almost 10 years ago. I think it was really nice experience, memorable, meaningful. I think what is important thing to mention is that as a MTTS is a social enterprise, and MTTS is as social enterprises under constant pressure because our margins are really slim and we have to just be very effective, efficient, and we work in very difficult markets. And when me personally working in an environment like that, this work is challenging and it can be very lonely as well. So it's a very lonely journey. Luckily, I have a wife that we work together. She understands me very well, but a lot of things stays with the family, and I think this is also not the optimal situation for further development. So when the group from Gift came in 2014, we had really something that was unusual for us. So we had a group of people with different backgrounds, different points of view, different experience, and especially when it relates to what we do, like we are, thinking outside the box, working the same things, even though it's a lot of different aspects, like a small universe running the social enterprise, it's still limiting, very, very limiting. It's not that you're going to see the things by yourself and you're going to understand everything very well. People coming from outside, we're going to see things differently, and they're going to have a lot of different daily points. Not all of them is going to be possible to implement, but there's a lot of very good information, and I probably will never be able to notice them because I'm just where I am. And I think this is really, really important, and that was really great. The group in 2014 was amazing, very energetic and full of ideas. And I think it was very important also to emphasize that most of them, if not all, came from ASEAN. And at the time, that was exactly what we needed, because we were in Vietnam, 80% Vietnam, and the remaining 20% was Laos and Cambodia. And we were stepping up at the time. We were really stepping up. A few devices were sent here and there, but it was just the beginnings of the plan, much bigger plan. And we had those people from the countries that we were just changing the ideas and gaining from the experience. And we were telling us what to expect. And even though it wasn't strictly related to medical equipment, but it was still important and very good to understand. And certain recommendations, obviously there's, the process, I'm not going to give it away to new participants, but after the process of finding out, studying MTTS and stakeholders, we had a final report, conference final report, and there are some recommendations that we are implementing. Some of them we couldn't, but some of them we did implement, and I think that was really, really of high value too. So one of the most important was related to diversifying the customer group. At the time, MTTS was almost exclusively selling to a single NGO that was doing multiple projects in many different countries. And it was a very comfortable situation because we didn't have to do any sales and marketing. It was just selling to the same customer. But it made us dysfunctional. So, and also not very prepared for the future. The history showed that the NGO, we survived longer than the NGO itself. And the NGO stopped existing in 2016 or 17, I don't remember. But it was 2014 when we started preparing for the future. So we were already diversifying customer base at the time, with the permission of the NGO. That was our biggest customer. So that was really important. But that was the conclusion from the final report as well. So that was among a few other ones. And altogether, I think it helped us to come up with the clear path for the future, and discovering new countries in ASEAN at first. Then we were talking about further away markets, but at the end we had something that had a high value, quality, expertise. And at the same time, we had a good time. You know, we were really enjoying those meetings, and I think we learned from each other quite a lot.
And from where you were at 2014 and where you are today, I have to say, Greg, the transformation has been astounding. It's been amazing. And right now, you not only serve Vietnam, but you serve other markets in other parts of the developing world, and all of that in about the span of about 10 years or so. And that is no easy feat at all. So in terms of managing this growth and in terms of sustaining this growth into the future, what would you say are your biggest challenges in managing this transformation? And in doing that as well, what would you say is your larger aspiration for MTTS, and what direction would you want to bring the organization forward, so that you can continue making a sustainable and lasting impact?
Mm. Well, we started in Vietnam as a small project. We expanded first in China, then ASEAN, and now we're delivering, selling the devices across 4 continents, including South America, Africa, and a little bit in Europe. So it is a success, but I think we are not done yet, that's for sure, because we don't have like established sales in each of the markets that we are present. I think maybe it is the nature of the business. They are accidental sales and very, very big sometimes. But as we getting more and more established in each of the countries, we try to also be present with what is happening with after sales service and support, and that it builds a stronger grounds for future activities. So I think this is a very, very big job, and we call it last mile operations, and these are really important and the most difficult, and especially further away we get from where we are, the more complicated it gets. This is basically, it's not only logistics that, it just makes things more expensive, but also cooperating with local partners in the countries that are very often very different to each other, crossing borders, building the stocks of spare parts and expertise for local servicemen. All those kind of things, and especially during COVID, were extremely difficult. So we were developing online test sets for training. But it's never gonna replace the in-person contacts. So we want to come back to that and really get it back on tracks and continue that expansion. So it's definitely the geographical expansion that we're thinking of. But this is not only gonna, and this is really, really difficult. And we spend a lot of time and money to continue that. And this is probably by far the most difficult process that we went through and continue going through. But we're also looking at things related to sales and marketing itself. So as we stopped working with a single NGO that we were totally ignorant about sales and marketing, not necessarily functions in our company at the time, we learned how important they are and how different they are to consumer goods. It's not even business to business here. It's a business to public entity, which is kind of a business, but it's really not. So we have to be really, really creative how we get our visibility to attract really public money, because that's our target. It's, we can obviously rely on NGOs and charities a lot in Africa, especially where we're kind of initiators of the future processes. But ultimately, that's a government job, and the target hospitals where we want to work. There's a lot of private sales, private clinics, private hospitals, but these are side gigs, side gigs that we're gonna do because we're not gonna refuse them with our technologies, but we really want to serve those who cannot the quality care at all. So this is our job. Sales and marketing, we build the team, engaging our partners, local partners, distributors. This is very expensive and long process. So this is where we want to improve for sure. And internally, I'm thinking the major change was in management in the company structure, the culture. Many people who start up businesses, they lock themselves in with being the person doing everything all the time. And this is a common mistake. And I think I don't need to explain anybody, but it can happen. So I was aware of that from the very beginning. And I think what I tried to do to delegate was to delegate responsibilities as much as possible, as early as possible. Obviously, for that, you need to have quality staff, and it doesn't come immediately. Even if a person is talented, has to come and get used to what's happening in the company, and so it's a process that takes time. I think on this area we are quite successful, and especially I must say for myself that I can focus on the strategic management as opposed to being bogged down the details of daily routine management. So I think that was really, really important. And altogether, that expansion and what we wanted to do is not only geographical; it's also the product. So we never stop innovating. I think this is very, very important, and also well-known truth that without innovation, you're just gonna get down versus your competitors. Everybody innovates, and there's a lot of very interesting technological improvements over those years, and we're looking at new ones as we speak, and we're making our devices unique. And at the beginning, we are developing the devices that were just mere cheaper copies of Western equipment that were doing the job, and that was great because we're cheaper. And this is a very slippery slope if you continue going this way. So in the next phase, we're adding the value, technological value. And we're a little bit lucky because, for example, in the lighting industry, there's a major change related to LED lights, which we used immediately. We were one of the first adapters to the LED lights, and we made our product innovative to the point that eliminated all the consumables and was very attractive and even cheaper than previous generations. So we looking at the same things, whatever is becoming available in terms of sensors and controllers, we implement as soon as they are available, and we bring it to the market. So we're talking about the fourth generation of existing devices already, and we keep innovating. We keep innovating, improving the old existing devices, but we're also adding the new ones to the portfolio. So at the moment, we have 6 medical devices in our portfolio that are certified in Europe with CE mark. Also, they are certified in multiple countries based on CE mark, but directly, like in Malaysia, it has its own certifications. And they are certified in Malaysia or the Philippines or Singapore. So these are done. We have one non-medical device, and we're looking at introducing another medical device next year. So as we expand geographically, we also expand our offer. It all contributes to the growth. Now, the growth so far was organic. We grew organically. Obviously, it's slower as we wish. And I think looking into the future, it is something that we may reconsider. So when you have these strong foundations in regards to the product and markets, we think that it's possible to accelerate that growth by engaging with strategic partner So looking for the investor, partner that is, has aligned vision and mission, and also brings to the table not only money, but the existing supply chain, network of distribution, things that are important and could accelerate dramatically the growth and impact that we want to create, the positive impact. So that's my things that coming in the near future, that a possibility. I'm not saying that we are committed, but a possibility, because unfortunately such a partnership, like any partnership, doesn't come without strings attached. So we have to be really careful and smart about it.
And also, Greg, in terms of the industry itself, I think you spoke about the discrepancy in the beginning and also the difficulty in finding partnerships. Where would you see the industry of neonatal care in itself evolve over the next couple of years or so? Because I'm also trying to see how do you intend to bring MTTS along, given your vision, given your mission for the company in the future, alongside these changes within the industry, because we've seen a host of we are very susceptible to diseases and a host of other issues that come together with neonatal care and newborns, especially in the developing world. So lining up those trends together with MTTS's vision, how do you see that coalescing in the future?
Yes, as I mentioned before, we are in the middle of the major industrial revolution. Some people call it fourth industrial revolution. There's a lot of things happening in the software and artificial intelligence. All those kind of things gonna contribute to the future technology and pretty much in all aspects of our lives. However, I really believe that our job is to make sure that those technologies are available to everybody, not only in high-end locations, not only hospitals, but generally in Western countries, developed Asian countries or America, but everywhere. So we put a lot of effort to use that technology to make it friendly. And I think this is, in our particular very narrow niche activity, we're talking about something that I really like, this catchphrase, called devices that are difficult to use wrong. So they're super simple, difficult to break, difficult to press wrong buttons, and something that it comes with the design. And behind those super easy devices, so there's a lot of automation. It's a lot of hard work. So they're easy outside, but extremely complicated inside. Not that they're complicated and easy to break, but they're just all those electronic circuits, everything that comes together does the job for the user. So I don't want to go into technical details, but there are solutions. You can instead of pressing 5 buttons, you can press 1 button, and the machine, using certain algorithms, calculations, gonna decide for you. And I think that's what we should do, especially in less developed places where the users are not as sophisticated. And the sad truth is that the training provided to the staff in developing countries is good usually for 6 months, because after that there's staff rotation, the nurses are trained, because nurses, by the way, are the most important users, not the doctors. The users on a daily basis are the nurses. They rotate every 6 months. So there is a lot of work. We're going to do the great machine. There's going to be a training. There's going to be a training, and the nurses 6 months later, there's somebody else who have no idea what's going on. So we really, one of our project is to establish cooperations we already have in mind with organizations, academia, and clinical associations that are going to be creating the on-screen training, or that can be repeated, simple slides, animations, really simple. And the new technology with the cheaper LCD screens, touch screens, that's another opportunity that wasn't possible before. It was too expensive. Now it's cheap enough to include that, so you can really address that very, very particular issue, which is really, really important. So it's further simplifications of user interfaces is one important step. And the second, provide the training that can be repeated in a very simple way, and with the references, and somebody needs something more complicated, further on to the sources, the online sources. And that solution is good for very wide spectrum of the hospitals, from very basic clinics somewhere in the middle of nowhere to really tertiary level hospital that is attached to the university, the best in the country. So we really have to cover that whole spectrum. And I keep saying to our partners that some of them come and, can you do this, this, and this? And I said, this, and this is going to work only for this particular situation. We need to do that. We have to look on the bigger picture when we approach the healthcare, because we working with so many different types of hospitals that we have to make sure that everyone is going to be able to use the devices. And with that, as the technology goes more sophisticated, I think things are going to be easier and easier for the users. That's the way I see the future. And I think also what is important to add is that very serious problem with medical equipment is related to the lack of maintenance. And lack of maintenance is always, or very often, blamed on lack of access to spare parts. So we also want to convince as many partners as possible and the buyers to make sure that this problem is covered within the price of the device. So we're thinking about offering vouchers to instead of cash, or the spare parts immediately because they're getting misplaced and cash is being misused. So we think about vouchers that they can come back and get when they need the particular spare parts covered already by the upfront price of the device. Simple solution, but not even high tech. Very simple, but something that's gonna be important to make sure that everything works as intended. And finally, I think we need to go global. We really need to go global as a company, because we are not as fortunate as companies from India and China that they have domestic markets of billions of customers. We are from Vietnam, and that was one of the major driving forces for us to go export-oriented. And I think this volume that we can create by going to more countries and more markets can help us keep the price under control and maybe even further reduce them. I think this is really just a very initial idea we have, and we're not sure how possible it is, but looking for strategic partnerships, and especially some sort of partnership I mentioned before that will be align us with the larger player. There's a number of them, but having aligned vision and mission. Ultimately seeking capital as well in public offers, but go in that direction that grow in size the company that will allow us to bring faster impact or impact faster when we do that now. Because I'm quite sure we're going to keep doing what we do for a long time. I just would like to see the results a little bit sooner, and that's the main point about looking for partnerships.
Thank you, Greg. And before we end our interview, I'm going to leave you with a bit of a challenging task at hand. You've spoken about your journey here. You've spoken about your vision and your intended destination, so to speak, for MTTS Asia. And if we strip away the business side of it, if we strip away everything finance related out of it, at the crux of it, MTTS Asia's noble mission of neonatal care is something that not a lot of companies or social enterprises out there aspire to do and can even do it. So taking all of that away and just looking at the crux of your mission here, and at looking at your purpose in starting MTTS and going through with this journey, how would you summarize this in one word or in one phrase?
Rewarding, very rewarding. So why you get up in the morning and you do your work? I think, again, think about yourself as the person who can contribute, and if you feel that helping others give you give you the reason to get up and makes you happy, basically, this is very, very rewarding. And I talk to my friends who work with other companies, and most of them just wait for Friday, get the weekend, and forget about it. For me, it's quite the opposite. I'm looking for Mondays, and I never stop working mentally, even at the weekends, and I don't mind it at all. So I think it's extremely rewarding work, and if you can be something like that, you can consider yourself very lucky.
Thank you very much, Greg. I wish you and I wish MTTS all the best, and also thank you for MTTS for being the project partner for GIFT's upcoming Asia Young Leaders Program. Thank you very much for doing this with us, Greg.
Thank you.